Gentlemen and gentlewomen of the Michigan State Senate, I am proposing this bill to solve the social issue of forced custody relinquishment in the case of mentally ill children in need of residential care that their parents cannot afford to provide. When a parent decides to do a psychiatric lockout for their child, they must do so after their child has been admitted to a hospital for a mental health episode. When Medicaid determines the hospital stay to be beyond medically necessary, the hospital must discharge the patient as Medicaid will no longer be paying for the stay. Beyond medically necessary can mean many things, but it usually means the child is stable for the time being. It does not mean there may not be another episode in the near future, and it does not mean that the underlying issue has been treated. To begin the lockout, the parents must first inform the hospital that they will not be signing out their child or taking them home. The hospital will then contact the Department of Child Protective Services and they will determine if the child has been neglected or abused. In most states, the child is first put under temporary police custody before a judge declares them a ward of the state. At this point, their treatment is funded by taxpayers and the state will do anything within their power to get the child adequate care. The symbolic red tape the parents were fighting prior to the lockout disappears. I hope I don't have to point out how troubling this is. Depending on the state, there are also potentially dangerous consequences for parents who choose to do a lockout. In many states, they can be charged with child neglect and abandonment, lose custody of their other children, or be unable to regain custody of the child they locked out. And that's not even considering the emotional toll it takes on a child to be legally abandoned by their parent. Unfortunately, the parents who make this desperate choice often have few other options. They are dealing with children who may be having violent episodes and who are a threat to themselves, their parents, and their siblings. We need to expand Medicaid and Children's Health Insurance Plan, also known as CHIP, to provide funds for residential treatment for mentally ill children when it has been recommended by their doctors. Additionally, and possibly more importantly, we need proper funds allocated for in-home and community care, as well as mental health screening and emergency mobile care. Ideally, these types of services in Michigan would help prevent the need for state-funded residential care and save money overall. We, the public, have been aware of the issue of psychiatric lockouts in our nation since the U.S. government's 2001 General Accounting Office, or GAO, report. But those who work in social services with affected families have likely known for much longer. Data in the GAO report from 19 states shows that in 2001, 12,700 children were locked out by their parents. Clearly, data from just 19 states means not only are we failing to provide proper services to families dealing with mental illness, but we are sweeping the problem under the rug by failing to collect proper statistics for mental health treatment in most states. The GAO also says their data is incomplete on the types of children who are being locked out, but it appears to be mostly male adolescents. It is simply not possible for families to pay for expensive residential services themselves. The average cost of a year of residential inpatient treatment is far greater than the median salary of a Michigander. Our current Medicaid system does not always provide adequate system for residential treatment. There are residential services for Medicaid recipients, but only certain facilities will accept Medicaid's low payment, and these facilities are often at capacity. When there's a long waiting list for a bed, this is not a viable option for parents seeking emergency care for their children. And Medicaid benefits, as well as types of services available, vary greatly from state to state. The 2001 GAO report determined that in at least six states surveyed, children on Medicaid actually had better support and less restrictions on care than children with private insurance. All of these 6 states had made optional expansions on Medicaid and CHIP to provide additional services not required by federal law. 11 states in the 2001 GAO survey have laws that are either forbidding custody relinquishment when no abuse or neglect is present, or allow parents to voluntarily and temporarily surrender custody for care without giving up permanent custody. We also know that Illinois passed a similar law in 2014. The state of Illinois has addressed its problem with lockouts with a Medicaid expansion to cover residential treatment, in some instances in the form of individual care grants. In Illinois, these individual care grants can only be obtained when several different state agencies work together. This has proved ineffective, likely due to the amount of red tape that prevents these agencies from interacting. These grants have been barely used since the legislation was passed. New York State has also expanded Medicaid to provide for more resources for families dealing with mentally ill children, focusing its services in the home to prevent the need for more drastic treatment options. New York's solution allows for Medicaid money for higher income bracket families to have a 24-hour on-call therapist available for emergencies. Some counties in Maryland provide mobile emergency mental health care that travels to the site where the child is having a crisis. And some counties in New Jersey provide free mental health screening in community centers, hoping to identify mental disorders and get treatment before a crisis occurs. State senators of the great state of Michigan, I urge you to follow the lead of these other progressive states and vote for this bill for the sake of these children and their families. Key points of this bill will be funding for preventative screening, in-home and community services for mental health issues, and funding for residential treatment as a last-ditch resort with no loss of custody. You will now hear testimony from experts in the field of social work, child psychology, and the history of mental illness treatment to understand why it is so vital that we approve this legislation.